Good day everyone. Today's second lecture of COVID-19 and kidney disease patients will be presented by Dr. MUHAMMED Kamal. He will discuss the management of dialysis patients and the management of dialysis center during this era. He will touch base also on staff and patient protection during this time. Thank you very much.
Good morning. Today I will present a second lecture for the series of our presentation regarding dealing with the patient during this pandemic of COVID-19. The first lecture by our colleague Dr. MOHAMED HEMEDA is focusing on the dealing with acute kidney injury in the patient positive COVID-19. Today's second lecture we will focusing on how to deal with the regular dialysis patient in both modality, hemodialysis and peritoneal dialysis patient, and patient suspecting or positive COVID-19 patient. We'll also discussing how to deal with the patient to protect them and protect ourselves during this pandemic of the COVID-19 crisis. Our objective for this presentation was involving precaution policy for dealing with the dialysis patient during the COVID-19 pandemic. After that, we will discussing the strategy of the dialysis and hemodialysis unit and peritoneal dialysis unit also. And the last, we will give a short brief about how to deal with the peritoneal dialysis during this era. First, we will give introduction about the infection. The COVID-19, as all we know, is a disease caused by novel coronavirus. It's currently pandemic, which produce high morbidity, especially in elderly patients, and also in the patient with associated comorbidities as our patient renal failure. CKD stage 5 dialysis patient on both hemodialysis and peritoneal dialysis, also vulnerable group because of the existing comorbidities. Repeated exposure to the hospital environment and immunosuppressed state of the patient is not only make this patient more prone to the acquired infection, but also they develop severe disease as compared to the general population. Patients on regular dialysis should adhere to prescribed schedule and not miss their dialysis sessions to avoid an emergency dialysis. We'll start with in the patient maintenance dialysis. This should be applied in both hemodialysis and peritoneal dialysis patient. Posters to be placed in entrance and waiting area highlighting the symptoms of the COVID-19 infection. And also posters should be placed at the entrance and waiting area advising on the hygiene measure regarding hand washing and sanitization procedure and cough and sneezing etiquette. The sample of posters recommend to be applied to the entrance of the dialysis unit. This slide shows us about how to cover during the cough or sneeze, and also to put the used tissue in the bin or in the plastic bag, and the proper washing of the hand prior to any procedure and after any procedure. Also, this poster shows us how to wash your hand and cover and sneeze technique, and also recommend don't touch unless it's essential, and keep also the social distancing around 6 feet at least, around 1.8 meter, and also stay at home. It is not necessary to go out, and get help once you develop any symptoms suggesting of the COVID-19 infection. Working team consisting of dialysis physician and nurse staff should receive training in updated clinical knowledge of epidemic COVID-19, notification of the infection and epidemic prevention tool, and guidelines from government, academy, society and hospital authority. All staff should be trained for cough etiquette and hand hygiene and proper use and disposal of the mask and gown, and using of eyeglasses and need to protect themselves. All hemodialysis units should be aware of the testing, triage, and notification policy. Also, staff should be self-monitor their symptoms and should inform the team leader in the case they has a family member develop symptoms suggestive of COVID-19 infection, and try as much as you can, don't touch the patient and don't use stethoscope unless it is essential. We will move for guidelines for hemodialysis. First, we will start for the patient, and second, we'll shift for the staff of dialysis. First, we'll start for the patient, and there's 3 steps before the patient arrives to the dialysis unit. After that, during the screening area and inside the dialysis unit. First step for the patient before arrival of the dialysis unit, all unit should instruct their patient to recognize early symptoms of COVID-19, like recent onset of fever, any sore throat, any dry cough, recent shortness of breath or dyspnea without major weight gain between dialysis session, any myalgia, any body ache, any fatigue and diarrhea, and should be contact dialysis staff before coming to dialysis center. After that, the unit need to make necessary arrangement for their arrival in the screening area. The patient who are stable can come to dialysis center without any assistance. Is recommended to come without any attendance. The screening area, every patient should be asked about the symptoms suspected of the COVID-19, as we mentioned above, and history of the contact of diagnosed COVID-19, and history of the contact of the person who had recent travel of foreign country or from the high COVID prevalence area. Second step in the screening area, dialysis unit should have designed a screening area where the patient can be screened for COVID-19 before allowing them to enter dialysis area. The screening area should have adequate space for implementation of social distancing between the patient and an accompanying person while waiting for dialysis staff. Patient with symptoms of the respiratory infection should put a face mask before entering screening area and keep it on until they leave dialysis unit. Dialysis unit staff should make sure that adequate stock and mask is available in the screening area to provide it for the patient and accompanying person if necessary. This algorithm showing how to deal without patient starting from the screening area till entering the dialysis unit. There's a photo for our center triage, and also there is a poster summarize what we mentioned before, as is the patient at home should be keep hand hygiene and self-isolation and inform any symptoms. During waiting area, keep social distancing and use sanitizer at disinfection. And for the staff should be trained well and ensuring full PPE and try to self-monitoring and stay at home if sick. The third step after screening area, inside dialysis unit. Suspected or positive COVID patient should be properly wear 3-layer surgical mask through dialysis duration. Patient should wash hand with soap and water for at least 20 seconds using proper method of the hand washing. If the soap and water is not readily available, it can be used alcohol at least 60% for proper washing. Patient should follow cough etiquette like coughing or sneezing inside the elbow or using tissue paper, and after this tissue paper should be thrown in the trash, and the center should be ensure the availability of the trash, plastic lined trash, and is be labeled to be for disposing of the used tissue. And it recommend also this trash can should be food operated ideally to prevent hand contact of this infected material. We're shifting for dialysis staff, also starting from the screening area and inside the dialysis unit. In the screening area, the unit staff should make sure an adequate stock of mask and sanitizer are also available in the screening area to provide for the patient and accompanying person if necessary. During dialysis, it should be ensured that the patient and the staff in the unit doesn't become the source of the outbreak. Dialysis chair or bed should have disposable tissue and waste disposal pins to ensure adherence to the hand and respiratory hygiene and cough etiquette, and also appropriate alcohol-based sanitizer within reach of the patient and the staff. Dialysis personnel and attendant and caregiver should also wear 3-layer surgical face mask while they are inside the dialysis unit. There's also a photo from our center hemodialysis unit showing the disinfection during the disinfection of the machines in between the shift of dialysis. Ideally, all patients with suspected COVID-19 to be dialyzed in isolation. First, the isolation ideally to be in the separate room with closed door. But if it's not possible, as in all units not have this option, the second next suitable option to use separate unit, preferably separate shift, preferably the last shift of the day. This offers the advantage of the avoiding long waiting period or the need for extensive additional disinfection in between the shift. Next suitable option, if the isolation room is not available and separate shift cannot be applied, can be a separate area for proven positive or suspected cases. If it's not possible, subject to the suspected patient or positive patient can be dialyzed and at the raw end within the unit, ensuring the full separation from other patients by at least 2 meters. The recommendation from International Society of Nephrology was updated in March 2020. If the patient doesn't have any symptoms suggestive of COVID-19, patient must wear also a surgical mask when they arrive and during the entire duration of the dialysis session. Also recommend is continuous disinfection, and if the patient is sneezing, use disposable handkerchief and throw them away after each single use. Separating equipment like a stethoscope or oxygen saturation probe or thermometer and a blood pressure cuff between the patient should be disinfectant with appropriate cleaning and disinfection should be done between shifts. Staff caring for suspected or proved cases shouldn't look after other patients during the same shift. Dialysis staff also should use all personal protective equipment (PPE) for proven or strongly suspected patients of COVID-19. And they also recommend to wear isolation gown should be worn over or instead of the regular cover gown. There is a question: can you use hepatitis B isolation room for COVID-19 positive patient? Hepatitis B isolation room can maybe used in dialysis patient if the patient with suspected and confirmed COVID-19 is hepatitis B surface antigen positive, and the patient with hepatitis B surface antigen positive, and the facility has detailed plan to clean the room and allow at least for 270 minutes before any hepatitis B positive patient arrive for treatment. This is a guidance from ASN. And this is a poster summarize what we mentioned before. They gave recommendation for healthcare team and also give recommendation for dialysis patient. As we saw, this is all summarized. This is a poster summarize of what we all mentioned in the previous slides. Second, the modality we're dealing with the dialysis unit is peritoneal dialysis patient. To ensure that all precautions should be applied for hemodialysis and peritoneal dialysis patient, as we mentioned, before arrival of the unit and during the screening area and during dialysis inside the dialysis unit. However, some special precautions and special recommendation for peritoneal dialysis patient. First, in the PD unit, non-essential procedure like PET test or clearance measurement should be avoided during pandemic to minimize unnecessary patient contact. And the patient visit should be kept to the minimum and should be only for essential issues like peritonitis, severe exit site infection, and poor training the new patient. Control the number of the patient per clinic session and speed all procedure done during the clinic visit to reduce the number of the patient in the waiting area and they can sit further apart. For the patient PD home management, patient should be at least 2 week peritoneal dialysis supply and sufficient medication in case they have to self-isolate. Other options, remote patient management should be strongly recommended as a major way to manage patient on peritoneal dialysis. And here in our unit, peritoneal dialysis unit, we are using what's called shared source. We can manage the patient remotely and can check his compliance, and we can apply adjustment of his prescription and give any advice by contacting the patient. The idea of this shared source device is modems connected to the machine given to the patient is connected to the machine and give shared source to our computer, and through our access we can access the dialysis machine for the patient, and they check the prescription, check the compliance, and check what's going on for the patient, and accordingly we will decide the patient continue the same prescription or we can make some modification of this prescription according to our assessment. And can also, I mentioned before, can advise the patient if any suspicion that the patient can deal inappropriately with this machine, can advise for him to contact him, advise to come to the center for clinical assessment. After that, for the hospitalized PD patient, elective or non-urgent admission should be rescheduled, and inpatient elective surgical and procedural cases should be delayed. If the PD patient and nursing team is involved with inpatient care, is preferred to have a separate team responsible for inpatient and outpatient PD care. Diagnosis and treatment of COVID-19 for PD patient. Management of the COVID-19 infection is the same for PD patient as for all other patients. Mild or moderate patient on PD can continue PD as usual without prescription adjustment according to the general evaluation. Severe or critically ill severe cases require life support due to multiple organ dysfunction syndrome can be transferred temporarily for automated peritoneal dialysis or bedside CRRT replacement. This is ISPD strategy regarding COVID-19 in the PD patient. Okay, this is the end of our presentation. I hope it's useful for you, and stay safe. Thank you.